Late breaking news. January is Cervical Cancer Awareness Month. So, this really isn't late breaking news, but you probably didn't know that. So, let's talk about cervical cancer and let's be aware. For most people, cervical cancer is a preventable disease. We have a vaccine, Gardasil 9, that is actually really effective at preventing. In the years 2012 to 2019, cervical cancer deaths decreased by over 65%, and so did invasive cervical cancer cases. With that said, we still have in the year 2024 over 13,000 cases reported each year and over 4,000 deaths each year. So we can do better, and that's what we're going to set out to do. Before we had the Gardasil vaccine introduced in the early 2000s, we had the pap smear, which we still use. Good news is we know that most people don't need that pap test every year. Back in the 1900s, the early 1900s, cervical cancer was the #1 cancer killer in women. Now it is way down the list thanks to this handy test. Not everybody's favorite test to get, but we know now that women should start getting them at age 21 and get them every 3 years. Once they get a little bit older, we do co-testing for HPV, and if it's negative, they only have to have the test every 5 years. Thank goodness. But what else can we be doing to help prevent? Also, safer sex practices are very important. So if you are not in a monogamous long-term relationship, you should be using condoms, encouraging your partner to use condoms so that you have that barrier in place to protect. Before we had Gardasil, that's what there was, that and abstinence. And knowing that abstinence is not an option that some people will choose, then make sure that you're safe. Use them 100% of the time, consistently, and it decreases your chances as well.
In fact, I want to talk to the president of the condom company.
If someone does have HPV or cervical changes, dysplasia, etc., then they recommend more frequent monitoring, and if indicated, you may need treatment. That can consist of a LEEP procedure, a cone biopsy, cryotherapy, or in some cases a hysterectomy. The good news is cancer deaths are going down. We have ways to prevent that from happening. The main thing is invest the time and effort in your health and don't ignore the screening. Armed with this awareness, let's set out to improve your health in 2025.